Hello, I'm Dale Johnson. Welcome in to LFR on LNK. The CDC says of 356,000 out-of-hospital cardiac arrests in this country each year, 9 of every 10 either happen at home or in public places, and someone sees it happening almost half the time. What if that was your dad? What if that was your mom, your brother, your sister, your daughter, your son having that cardiac arrest? You'd want someone to help. In Lincoln, they do, about 70% of the time, significantly higher than other cities in this country. The likelihood of surviving decreases by 10% with every passing minute. And from the time I said hello to you until now, it's been a minute. We talk about cardiac arrests today, and the fact that few cities in this country work hard at improving their cardiac arrest survival rates than Lincoln, Nebraska, at making sure that people survive and go on to positive outcomes in their life. We talk about that today. One expert is Dr. Jason Kruger. Dr. Kruger is Lincoln's EMS medical director and has been for the past 10 years. And also you will meet Neil Detlef. He knows about the survival rate here in Lincoln. He had a cardiac arrest in our city about 3 months ago, and he's here to talk about it. Dr. Kruger will take you behind the scenes, and Neil will share his experience with us today. Dr. Kruger, thank you. Neil, thank you for coming in. Nice to meet you.
Thank you.
On average, the cardiac survival rate here in Lincoln is about 32%. 6-year average is about 50%. Are those statistics correct?
So we've been working really hard with improving our survival rates from sudden cardiac arrest in our community. Last year in 2020, we had an overall survival rate of 16.9%, which is well above the national average of 9%. We had a survival rate for witnessed shockable cardiac arrest of more than 35%, which was also above the national average for witnessed shockable cardiac arrest.
That's the statistic for the 35%. All right, break it down. What factors go into making Lincoln a good place to have a heart attack?
We have been really focused on this and trying to improve survival for the last 10 years since I joined as medical director. In 2013, we were the first EMS agency in the state of Nebraska to be accepted into the National Cardiac Arrest Registry to enhance survival. So we started measuring this in a standardized way. And by the time we had our first full year of data, we recognized we were above the national average, but not as high as we wanted to do. So we have been working intently on improving every link in that chain of survival, from bystander CPR to rapid response to high quality CPR to getting appropriate patients quickly to the cath lab, getting those patients cooled, and getting them back home, back to work, and back with their families.
I mentioned that in more times than not, someone sees a cardiac arrest.
Mm-hmm.
There are different ways to react to it. Someone can call 911, someone can begin the CPR, someone can find an electronic device that's perhaps nearby, and we can talk about that too. But if you could, give the components that a witness, I've mentioned some of them already, but talk about the components that witnesses can do themselves before EMS even gets there.
Absolutely. That's really a critical thing as we try to improve our survival, is getting CPR started as quickly as possible and getting defibrillation done as early as possible. So if someone sees somebody collapse, activation of the 911 system is critical. But then our 911 dispatchers are going to ask the caller, is the patient awake? Are they breathing normally? And if they're not awake and they're not breathing normally, we need to start chest compressions, because that abnormal breathing might be agonal respirations. And then our dispatchers will talk the caller through how to do CPR to allay some of that fear, and then coach them on the appropriate chest compression rates. So we're doing high quality CPR, which is really important to get that started before the arrival of EMS.
Let's stay on dispatch for just a while. You talk about links in the chain. That's really the first one. There's someone that witnesses it, someone that then gets on the phone to 911, there is a link. Someone has to make a call.
Mm-hmm.
Then you have a link in the chain from dispatch. Talk about dispatch for a while. Their techniques have changed a bit. Instead of asking, they pretty much recommend or strongly suggest that here's what we're going to do, you're going to perform CPR.
We've been giving CPR dispatch instructions for years, but we've really worked with our dispatchers to try to improve recognition of cardiac arrest, and then when we recognize that, to be very assertive in order to get chest compressions started. It's very rare that somebody calls in and says, oh, I'm here, I'm on scene, somebody suffered a sudden cardiac arrest. They don't communicate that. So the dispatcher just being able to pick up that, hey, this person's in cardiac arrest, statistically almost triples the patient's chances of survival. And then it's awesome if somebody has a sudden cardiac arrest and there's an off-duty paramedic or nurse or physician there, but most of the time that's not the case. So it's up to our dispatcher to give that caller some just-in-time training on how to do high-quality chest compressions to really improve our chances of getting that patient out of the hospital alive.
Let's bring Neil into the conversation. Neil, introduce your situation to our viewers. You're from St. Paul, Nebraska.
Yep.
You were in Lincoln May 1st of this year for a wedding reception.
Yep.
Here in Lincoln. What happened?
Basically, I'm going to have to tell you through somebody else's eyes because I didn't remember anything of it. Basically, my wife and I had been out on the dance floor, got off the dance floor, sat in a chair, basically I dropped. A friend of mine checked for a pulse right away. There was no pulse, and he was going to start CPR, and then one of the bridesmaids, who happened to be a nurse, came over and started the CPR herself. After that, basically, somebody had already made the call in. Lincoln Fire and Rescue, who had a station fairly close to the reception, were there within minutes. From there, they transported me to the Nebraska Heart Institute. Eventually, a week or so later, I became aware of what was going on. And like I said, everything that happened that time, during that time frame, I was not aware of anything. But so kind of it's my part of my story, but I don't remember being part of it.
Go into that story, Dr. Kruger. The fact that, fortunately for Neil, there was a professional, a medical professional. That doesn't always happen. It's nice when it does. But here's a situation where someone starts CPR immediately, someone else calls, and by the time EMS shows up, steps have been taken to keep Neil alive. When EMS gets there, talk about the transition from a witness to this event to professionals taking over.
So with this story, I mean, this is just an amazing kind of opportunity to share a survivor's case. We're gonna, I mean, when Lincoln Fire gets there, we'll take over, start doing CPR. We'll get a defibrillator on as quickly as we can to analyze what type of heart rhythm the patient is in. Is he having a shockable cardiac arrest? And if so, the more quickly we can get somebody defibrillated, the better their chances of survival. And we were able to get multiple defibrillations. And the unique thing about Lincoln is in most communities you would be taken from the scene to an emergency department. And it sort of pains me as an ER doctor that the value is not in getting to the emergency department, it's in how quickly can we get to the cardiac catheterization lab in these cases. And in this case in Lincoln, Neil went straight to the cath lab, never went to the emergency department. So the cardiologist could more quickly identify what's going on, where do we have vessels blocked, how quickly can we start cooling this patient in order to maximize our chances of a good neurologic recovery, which again, this doesn't happen in many places in the United States.
Let's emphasize and let's stay on that point. The fact that en route from the wedding reception, where Neil is having a good time until he had a cardiac arrest, until he pulls up at a medical facility, a hospital here in Lincoln. What's taking place in that ambulance that allows Neil to go straight to the cath lab and bypass ER?
So we're able to do high quality chest compressions. We have mechanical CPR devices that can do CPR while we're moving to the hospital. We are able to quickly analyze and defibrillate. We measure our CPR fractions. We measure how long are we pausing chest compressions to analyze and to do procedures like getting an advanced airway in. And then we are able to identify where that culprit lesion might be by doing a post-arrest EKG, so that the cardiologists ahead of time know, what vessel may be blocked, and then get to the cath lab. We can open up the vessels if there's blocked vessels and quickly put in a cooling catheter, again, to achieve this therapeutic hypothermia, to really protect the brain as it recovers, and as we try to get the person out of the hospital alive.
That's a lot going on, Neil.
Yes.
as you're being transported from a wedding reception to a place where they can work on you in a stable environment. And this doesn't happen, Dr. Kruger, in, fair to say, most cities in this country?
It's, I think the saying is, it's not hard, but it's not easy. And we have been focused really intently on every link in that chain of survival as we try to maximize our cardiac arrest outcomes. Focusing on one link isn't enough. So when we started, we focused really hard on Lincoln Fire doing high quality CPR, which is important, but that's not enough. We have to focus on getting the public aware of the importance of doing CPR. We've had, apps like PulsePoint where people can download this and respond and do CPR if they're nearby and somebody's having a cardiac arrest in a public location. We've worked to enhance the number of AEDs out in the community and getting those in the schools and getting those with law enforcement, where we have law enforcement with all of their vehicles getting on scene before Lincoln Fire in order to defibrillate somebody. And then again, working with LFR, but then working as we transition to the hospital and getting appropriate patients straight to the cath lab so we can improve our chances of survival.
History is going to have an asterisk next to 2020 in just about every category in our lives. 2020 was again, fair to say, strange year, off year. How would you describe 2020 in terms of LFR statistics?
It was an unusual year, obviously, across the country with COVID. For the first time, we saw our national cardiac arrest survival numbers dip, where they had been 10.5% every single year since 2013, and then all of a sudden in 2020, those dropped down to 9%. Our survival statistics from kind of witness shockable cardiac arrest across the country also dropped that year. It's speculation to kind of figure out what exactly caused that. You certainly wonder if people were putting off things and putting off care, if that contributed to that drop across the country. But again, we still did very well kind of maintaining overall survival numbers of almost double the national average.
I think this is a good opportunity to point out how important it is to report not feeling well or someone else reporting it, because LFR didn't lessen its endeavor to try to save people. The hospitals didn't. There weren't statistics at the professional end that reduced the 2020 numbers. It was the fact that, and speculation is, that people just didn't report. Mm-hmm. They were quarantined, they were isolated, they were COVID scared, and those statistics at the public's end more than likely contributed to the statistics being lower.
Very, very likely.
Accurate?
Very, very, very likely. And just, I suspect the number of cardiac arrests that occurred in private settings likely increased as less people were kind of out in public. And if you're going to have a cardiac arrest, it's better to have it in a public setting where there's people to witness it and people to activate the 911 system and start chest compressions before the arrival of EMS.
I understand that you have, I don't know if you still do, ride-alongs with the medical supervisors. Why do you do that?
I've been doing that for the last 10 years since I started. I have, every time I have the opportunity to, I'll ride along with our EMS shift supervisors to kind of monitor how well our system's performing. And that was one of the reasons why we really kind of changed how we worked on cardiac arrest, because going on scene and seeing the amazing high quality CPR that we can do on scene, and recognizing that there's not really a lot extra we do in the emergency department. Our focus initially should not be let's get this person to the hospital as quickly as possible. Our focus is we need to get a pulse back on this person before permanent brain damage occurs. So really focusing high quality CPR right away, minimizing pauses in chest compressions is important. And we've done a number of things, even with the introduction of mechanical CPR devices, to reduce pauses in chest compressions, which we know is detrimental. I mean, anytime we're not pushing on the chest with a patient in cardiac arrest, there's no blood going to the brain and there's no blood going through the coronary arteries. So we need to maximize our chest compressions in order to maximize survival.
In the time we have left, let's quickly look at 2020 numbers. I mentioned that it was an anomaly. It was different because of COVID. If you look at the statistics, non-traumatic cardiac arrest cases, that was the 148. That number is different than a typical year, correct?
We bounce up and down. That number was not that far off. We did see more witnessed shockable cardiac arrests, which again, I wonder if people were kind of putting off symptoms where we were getting more of those witnessed shockable cardiac arrests.
That and people were at home. If there was someone else in the household, and if Neil was not at a wedding reception, if he was at home with his wife and or family, you would have had witnesses to your event. And that would have increased perhaps the chances of Neil doing well. In this case, it was it an off-duty nurse, you said? A registered nurse
yes.
that was there at your reception? Yeah. You need to invite more medical people to weddings. I think that's the takeaway that we have from this conversation right here. Make sure you have a medical professional in your wedding reception. Let's revert back to the 70% too. I think that's kudos to members of the public, because you can put pulse points out there, you can put comparable apps out there, but if the public doesn't accept it and act on it, feel emboldened to be able to, feel confident in being able to do that sort of action, then it's a waste of effort. So kudos to the public.
I think you really bring up an important point. When we started measuring our bystander CPR rates in our community back in 2014, we had about a 35% bystander CPR rate. And we have really focused on public education on the importance of doing chest compressions. We have focused on apps like PulsePoint. We've also worked really hard with our dispatchers in recognizing cardiac arrest and being very assertive in getting chest compressions started. And there are only a few communities in the United States that are breaking 70% for bystander CPR rates. And we know that is a huge driver of getting more people out of the hospital alive. And again, I would just say, in 2020, if we were a completely average community, we should have had 13 survivors. And last year, instead of 13 survivors, we had 25 survivors. That's 12 more people that get to go home, go with their families, go to work. And that's, again, just a testament to our community coming together and really trying to save lives.
In a COVID year. So good for you. Good for you for taking action. Neil, how are you feeling these days?
Feeling very good. Walking about 2 miles a day on a treadmill and getting back to work, so everything's going good.
Dancing?
I actually went to a reception last Saturday and actually did dance, so.
Good.
And
Good.
survived that one, so.
Good. Well, we're glad you're here, alive and well, and willing to tell your story. Thank you very much. Good health to you.
Yep, thanks.
And Dr. Kruger, thank you very much.
Thank you.
We'll talk again about the successes of LFR. We do that every month here in the studios of LNK TV. Join us. I'm Dale Johnson. Thank you for watching LFR on LNK.